Assalamualaikum and hi, my name is Putri Syamli Tutoh, ID number 20208584776 from Group 2. For this presentation, group video task for Bio 1 to 2. My fellow and I will present about bone and blood, which is the connective tissue too. But before that, let me introduce my friends.
Hi, my name is J. Arya Natalia binti Muhammad Fazil and my student ID is 2020894724.
Hi and Assalamualaikum. My name is Nur Atira binti Khairil Anwar.
Hi and Assalamualaikum. My name is Amira Adlina binti Jumat.
Hello everyone. My name is Hezron Maraun. Connective tissue is made up of cell, fiber, and a gel-like substance. Like all type of tissue, it consists of a cell surrounded by a compartment of fluid called the extracellular matrix. Connective tissue can be divided into two groups, which is proper and specialized. But today we are just going to focus on the specialized connective tissue for bone and blood. So the first one is bone. Bone has a large amount of matrix material. That the first one is the organic matrix and the second one is the inorganic matrix. Bone tissue, which is also known as the osseous tissue, is very hard connective tissue, which have a calcified matrix containing many collagen fiber, the osteocytes which lie in lacuna, and it is very well vascularized. And of course, the bone tissue is located in our bone. There are three types of cell in bone, which the first one is osteoblast, which is active in making bone for growth and remodeling, and the second one is osteocyte, which is found in lacuna of the bone and assists in maintenance of the bone. And the third one is osteoclast, which active in breaking down bone for bone remodeling, which is providing access to calcium stored in tissue in order to release it into the blood. The function of bone tissue is to support our body to make up the framework and to protect important organ in our body. And it also stores calcium and other minerals and fat. While the bone marrow is the site where the blood cell will be formed. Some of the diseases that caused by the malfunction of bone tissue is the rheumatoid arthritis and scleroderma. Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just our joint, while scleroderma is a disease that most often occurs in women than in men.
Structure. So essentially, this is the normal or healthy joint, but as it got inflamed, the synovial membrane surrounds that's supposed to make it movable started to grow new blood vessels and form a thick area called pannus. As it grows, it destroys areas of cartilage and bone inside the joint. Inflammation causes fluid build-up in the joints, making the joint swell. Without treatment, the joint space narrows and ankylosis can occur. Ankylosis is fusion and growing together of bones in the joint. This results in the loss of the ability to move the joints. Structure. There are two kinds of scleroderma. First is localized scleroderma that is mainly effects on skin. It happens in one of two forms, morphea and linear. Secondly, systematic scleroderma that also have two types, which is limited scleroderma that also known as CREST syndrome, and lastly is diffuse scleroderma.
Location for the bone diseases. Rheumatoid arthritis. Rheumatoid arthritis mainly attacks the joints, usually many joints at once. Rheumatoid arthritis commonly affects joints in the hands, wrists, and knees. In a joint with rheumatoid arthritis, the lining of the joint becomes inflamed, causing damage to joint tissue. Scleroderma. Scleroderma harms structures beyond the skin such as blood, vessels, internal organs, and the digestive tract. Systemic scleroderma. It can also affect blood, vessels, muscles, and joints.
Causes for rheumatoid arthritis. Rheumatoid arthritis occurs when your immune system attacks the synovium, which is the lining of the membranes that surround your joints. The resulting inflammation thickens the synovium, which can eventually destroy the cartilage and the bone within the joint. The tendons and ligaments that hold the joint together weaken and stretch. Gradually, the joint loses its shape and alignment. The exact cause of rheumatoid arthritis isn't known. However, certain factors seem to play a role in increasing the risk of developing rheumatoid arthritis or triggering its onset. Next is causes for scleroderma. Scleroderma results from an overproduction and accumulation of collagen in body tissues. So, most likely, scleroderma is caused by combination of factors including immune system problems, genetic and environmental triggers. Also, doctors don't know what causes scleroderma. It's one of a group of conditions known as autoimmune diseases, which this happen when our immune system usually protects us from germs, instead causes inflammation of our skin and other organs. So the signs and symptoms of rheumatoid arthritis may include tender, warm or swollen joints, the joint stiffness that usually worse in the mornings and after inactivity, fatigue, fever or lost appetite. As this disease progresses, the symptoms often spread to the wrists, knees, ankles, elbows, hips, and shoulders. And in most cases, the symptoms occur in the same joint on both sides of your body. The symptoms of scleroderma is thickening and swelling of the fingers, pale fingers that may become numbed and tingle when exposed to cold or stress, or known as Raynaud's phenomenon. Next, joint pain, taut, shiny, darker skin on large areas, which can cause problems with movement. Limited mobility or immobile fingers, wrists, or elbows because of the thickening of the skin.
Effects bone diseases, rheumatoid arthritis, uneven stance in your ankles, weakness in the knees, finger pain and redness, wrist numbness, and difficulty breathing. Scleroderma. Scleroderma is a long-lasting disease that affects your skin, connective tissue, and internal organs. It happens when your immune system causes your body to make too much of the protein collagen, an important part of your skin. As a result, your skin gets thick and tight, and scars can form on your lungs and kidneys.
Treatments and preventions. Bone disease. Rheumatoid arthritis. Treatment. There is no cure for rheumatoid arthritis, but clinical studies indicate that remission of symptoms is more likely when treatment begins early with medications known as disease-modifying anti-rheumatic drugs. Preventions. There is no known way to prevent RA2, but you may be able to lower your chance. If you smoke, quit. Lose weight, especially if you're 55 or younger, and there may be a link between RA and periodontal gum disease, so brush and floss and see your dentist for regular checkups. Scleroderma treatments. Getting pain relief through non-steroidal anti-inflammatory medications or corticosteroids. Preventions. Frequent use of bath oils and moisturizing lotions and or ointments can help soften the skin, and a cold water room humidifier can keep the skin moist.
The second connective tissue is blood, which is referred to the red and white blood cell inside the fluid matrix, which called the plasma. Red blood is also known as the erythrocyte, and white blood known as the leukocyte. Erythrocyte is the greatest abundant cell in blood. It is responsible to transporting oxygen to body tissue, while leukocyte is the immune system of our body and involved in defending our body against both the infectious disease, and foreign material. Some of the diseases that caused by the malfunction of blood is thalassemia and leukemia. Thalassemia is an inherited blood disorder that causes our body to have less hemoglobin than normal, while leukemia is a blood cancer that caused by a rise in the number of white blood cells in our body.
Structure. So this is blood vessel, which is where all of the blood is contained, like red blood cell, platelets, and white blood cell. These cells are made from inside the bone. If we look inside the bone and if we take slice of it like this, we'll see red spongy tissue called bone marrow. But for leukemia cancer patient, their white blood cells starts multiplying really rapidly and out of control and starts overtaking the bone marrow that leaves behind very little space and very little food for other cells to grow that make it not able to make many others normal healthy blood cells.
Location for blood diseases. Thalassemia. Thalassemia disease are not able to make enough hemoglobin, which causes severe anemia. Hemoglobin is found in red blood cells and carries oxygen to all parts of the body. Leukemia. Leukemia starts in the soft inner part of the bones, bone marrow, but often moves quickly into the blood. It can then spread to other parts of the body such as the lymph nodes, spleen, liver, central nervous system, and the other organs.
The causes of blood diseases. First, the causes of thalassemia. Thalassemia occurs when the abnormality or mutation in one of the genes involved in hemoglobin production. If only one of your parents is a carrier for thalassemia, you may develop a form of disease known as thalassemia minor. You probably won't have symptoms, but you'll be a carrier. Some people with thalassemia minor do develop minor symptoms. If both of your parents are carriers of thalassemia, you have a greater chance of inheriting a more serious form of this disease. If you inherit two or more copies of abnormal genes from your parents, you may get mild to severe thalassemia, depending on what type of protein is affected. Next is causes of leukemia. Leukemia develops when the DNA of developing blood cells, mainly white cells, incurs damage. This causes the blood cells to grow and divide uncontrollably. The abnormal blood cells do not die at a natural point in their life cycle, but instead they build up and occupy more space. As the bone marrow produces more cancer cells, they begin to overcrowd the blood, preventing the healthy white blood cells from growing and functioning normally. Eventually, the cancerous cells outnumber healthy cells in the blood, like this. What causes the damage to the DNA in the first place is still not known in all cases. Scientists have been able to locate changes in certain chromosomes of patients diagnosed with different types of leukemia. Next is the symptoms of blood diseases for thalassemia and leukemia. The most common ones may include bone deformities, especially in the face, dark urine, having a delayed growth and development, excessive tiredness and fatigue, and yellow or pale skin. But not everyone has visible symptoms of thalassemia. For leukemia, so the common signs and symptoms may include fever or chills, persistent fatigue, weakness, frequent or severe infections, easily losing weight without trying, swollen lymph nodes or enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tiny red spots in your skin, excessive sweating, especially during night, and bone pain or tenderness.
Effects for blood diseases. Thalassemia. When there are not enough healthy red blood cells, There is also not enough oxygen delivered to all the other cells of the body, which may cause a person to feel tired, weak, or short of breath. This is a condition called anemia. People with thalassemia may have mild or severe anemia. For leukemia, heart conditions or damage such as chronic heart failure and heart muscle injury, thyroid problems, lung damage such as scarring, inflammation, acute respiratory distress syndrome, and lung failure, infertility including premature ovarian failure and premature menopause in women, and low testosterone levels and sperm counts in men.
Treatments and preventions. Blood disease. Thalassemia. Treatment. Frequent blood transfusions. Most severe forms of thalassemia often require frequent blood transfusions, possibly every few weeks. Prevention. You can't prevent thalassemias because they are inherited, which passes from parents to children through genes. Leukemia. Treatment is chemotherapy. And there is no known way to prevent leukemia, but avoiding tobacco and exposure to pesticides and industrial chemicals might help to prevent it.